everyone. My name is Sonakshi Gandhi. I'm a clinical psychologist at the Mind Garden. There are many individual differences between people with respect to how much a particular surgical procedure, such as a knee replacement surgery, or a chronic pain sort of an illness, causes them pain or limits their functionality. Psychological factors such as symptoms of depression, health anxiety, and overthinking are commonly associated with disability and pain intensity in patients having problems such as arthritis, chronic pains, and fractures. Psychological factors, along with medical care, are extremely important in the treatment of many medical conditions such as cancer, diabetes, and even heart conditions. There also seems to be a strong link with orthopedic conditions as well. Continuing our video series about conversations on mental health, we will be talking about orthopedic issues and their association to mental health. To reflect on this, I have here with me a very special guest, Dr. Gurinder Bedi. Dr. Bedi is the HOD Orthopedics at Fortis Hospital, Vasant, Kunj. He has over 25 years of experience in joint replacement surgeries, sports medicine, and trauma. Dr. Bedi is an extremely well-regarded and an excellent clinician. I thank you, Dr. Bedi, and I welcome you to be a part of our video series.
Thank you, Sonakshi, and thank you so much for having me. It's wonderful being a part of your series, and it's a matter which is fairly close to my heart because of the kind of practice I have and the amount of exposure I've had with this kind of a problem dealing with some of my patients. And so thank you so much for bringing up this issue.
Dr. Bedi, for the benefit of those watching us, please tell us a little bit more about yourself.
Okay, so Sonakshi, I trained in Delhi for my graduation, post-graduation. After post-graduation, I started working in England, where I worked for about a good 12 years. I've been now back in this country for another 13 to 14 years now. And I work in a hospital called Fortis Hospital in Vasant, Kunj. We have a lovely bunch of guys that work together. It's a very team integrated approach, and part of my learning, my experience is what I've tried to put into my team practices as well. So it's a mixed practice. There are lots of general orthopedics, lots of joint replacement, sports medicine, foot and ankle. So a lot of things happen in our unit, and fairly busy kind of a department we have.
Dr. Bedi, for those who are watching us, there is a lot of research evidence that says that there is a connection between the mind and body. We've seen it around us, and even the research points that out as well. Could you help us understand a little bit more about this in terms of orthopedics?
Sure. So in my opinion, the mind and the body work as together. I mean, anybody who thinks he can treat the body without having a mind element get into it is sorely mistaken. It's definitely not going to happen. So the mind is the one thing that drives the body. I mean, it's like having a Rolls Royce with no fuel in it. So you can have the best of the bodies and all, but unless the mind is healthy, active, fresh, looking forward with enthusiasm and all, you can never really treat a patient. So again, it's a composite of things. So we've known that for lots of years. You can actually spot a winner pretty much very, very quickly when they come with an ailment. Some of them come with that, that whole, it's almost like a baggage and saying, I'm ill, I'm sick. And the other people is them, look, just got this one problem, get this sorted out, and I'll be on my way. I hate this because, this is stopping me from, going out to parties, stopping my dancing. I can't run. Those kind of things is what you really need. You need people to come rather than, people who are going to moan and groan about how bad life is and I can't do this and I can't do that kind of thing. So that's where the mind comes in.
We also have been seeing that, there are orthopedic conditions that could be caused or influenced by psychological factors. What has been your experience in dealing with such conditions?
So actually, Sonakshi, that's a fairly big chunk. Again, don't get me wrong. I'm not trying to say, it's a mind problem kind of a stuff. Again, as you rightly said, it's a mind and body problem. So we see a lot of people who come and, they come with these, they're about 30, 40 years kind of stuff. And there are a lot of thick files and notes which come with them. And you look through the notes and you realize that, look, this patient's been through everybody. He's been investigated almost every month with a new doctor. Somebody gets an MRI, somebody gets a CT, somebody's getting X-rays, their blood test repeated every 3 months kind of a stuff. And obviously there is some subset, which is like, the real organic problem, sometimes like an inflammatory arthritis, which will be there. And I'm agreeable with that. But there's a significant percentage in which you think that, look, everything has been done and nothing organic has been noted, which is to say, you haven't really picked out any named illnesses. And, we're living in Delhi. I mean, we are hardly the backward health society of the world. And, you would have thought somebody would have picked up something. Again, give the patient the benefit of doubt. Start all over again. Maybe somebody missed something. But, keep an open mind that, look, you really don't want to convince that patient more and more that they've got an illness. You look at it and say, look, I think there might be something more to it than this. Again, I keep repeating, it's not saying, oh, you're mad. All I'm saying is there's something in your mind which is influencing what your body is doing. So some people would call it a stress. Somebody would call it an anxiety. Some people would call it a depression. But, something which is sensitizing your brain to react abnormally to that particular situation. So just to give you an example, so we see a lot of these, the neck and the shoulder pains. We see a lot of people coming in with low back pains, the funny feelings in the hands going crampy, dead. And when you look at them in the background, a lot of them will tell you, oh, I've got this huge problem with my abdomen. My digestion doesn't work. I keep getting these headaches all the time. I can't get out of bed. I can't fall asleep. I keep getting palpitations. These are fairly, the sweaty palms kind of is a fairly good indication. Look, something is not right. You've had so much investigation. You've been to so many places. The symptoms are not fitting in with the investigations which are done. So we see a fair chunk of people with these kind of problems. And again, it's not a very easy thing, diagnosing it. You don't want to be the one who just labels somebody off with, oh, you don't have a problem, and, end up. But you need to keep your mind open, but you need to give a fair thought to this patient and say, look, I think we need a combined approach is what I would say in these situations.
Flowing from what you just said, if I as a patient want to try and understand the condition that I'm experiencing, for instance, if I'm experiencing chronic pain, how can I tell as a patient that this is organic or medical, or is it maybe psychological? How do I make that difference?
Okay, so it's not easy at all. And, for a patient, their problem is the biggest problem in the mind. So something to do is have an empathy for that patient and say, look, I can, understand what you're going through, mainly from my past experiences and all that. So now if the patient's symptoms are very non-specific, so, if you say, look, it's there throughout the day. So whether I sit, I stand, I lie down, they're there. But when I'm watching a movie or when I'm with my friends, I don't have a problem. If I go on a holiday, I feel very, very good. If I'm listening to music, or if I'm, if somebody's an artist or they're practicing a musical instrument, I can do that quite easy. That is the kind of thing which gives you, look, in your state of happiness, where your mind is controlling your body and you're in yours, feel good kind of an environment, your pain is taken away, which means you can actually control your ailments. So the other things, I think, like, the sweaty palms kind of stuff, then you say, look, nighttime is the worst. I go to bed, because all the extraneous influences are switched off. The television is switched off. The whole house is in a darkness, and you don't fall asleep. Then you start noticing these bad feelings in your mind, and suddenly the pain increases. That's a very typical kind of a problem. And remember, the type of personalities are there as well. So people who I got inflammatory, my irritable bowel is giving me lots of problems. I keep getting this palpitations again and again. So, and you can look at the number of visits to the casualty and say, the patient's been coming so many times, and, things like the ECGs and the blood tests are all normal. Those are the kind of things. The feeling of tightness in the muscle, another big loser, in terms of, that it's tightness, yes, but it's not really sort of, the joints are all free, full movements. So that's another typical thing that people will present.
So, you mentioned that you're an advocator of wanting to make this a more holistic or a balanced approach in general in medicine. But what would be your message to medical practitioners to be able to do this? How, in real terms, can somebody make their practice more holistic, more balanced, to incorporate for these, allied fields to be a part as well?
So one thing is, we must approach with an open mind and give time to the patient. It's not going to be a 5-minute consultation in which you ask two questions, get a quick X-ray, and that's it. That's done or not done, whatever. So that's not going to be the approach to take. So one is give the patient a fair hearing. As I said, you need to be open to this idea, but not close your mind to other diagnosis. Second, go through the investigations and everything carefully. You think something is amiss, rule that out. Very important, rule it out. You don't want to condemn a patient to having nothing, but again, don't do extra investigations. Don't keep sending the patient to, one more specialist. So just, compose it together. It's not, you don't need to be an expert in a certain field to know that this is not going to show up something. So give the patient time to only necessary investigations, and don't keep repeating it. If they're not there the first time, it's not going to say in 3 months' time, it's suddenly going to show up. Third is, sometimes you need to confront the patient, ask them the kind of question that we discussed before as well. Tell them if they tried other kind of therapies. Don't dismiss it, but just say, look, have you tried thinking about, maybe doing yoga, maybe doing some meditation? Have you even thought about, seeing some of my psychology colleagues, people like yourself? Have you tried sort of, changing the circumstances? Maybe it's a work related thing in terms of, this work doesn't work out. I really believe that physical activity is a fairly important thing. So stimulating your endorphins in the brain, which give you that sense of well-being, is such a great idea. So I really try to push people to get outside the house. For me, getting outside the house is a big winner. People who get outside the house, even if they go and sit in a coffee shop for 1 hour, 2 hours, read a novel, develop an interest, is a very good thing. But must take into account, not easy. Use your colleagues judiciously. So the pain clinic thing, which is very popular in other countries, as a psychologist, as a psychiatrist, as an occupational therapist, as a physiotherapist, has a physician, and has an orthopedic surgeon also. So it's a combined kind of a thing. When people look at it, it's almost like a panel, and you sit and say, look, we've looked at all of this, we've discussed all of this, we would like you to bring these changes. So multidisciplinary, very important. Use your physiotherapist, use your psychologist. Not saying drug-based treatments. All I'm saying is more counseling, more discussions, and suggestions. When people are sensible, they do take suggestions when they're put together.
There'll be a lot of people watching this right now, Dr. Bedi, who are contemplating whether or not their issues could be psychological. But there are also cultural, social stigmas attached to mental health. And even when a doctor kind of tells you that you need to go in and see someone, there are a lot of barriers and resistances that as a patient you go through. One of them being denial, the main one probably, not wanting to see your issues as mental and more physical. How does one deal with that?
That's a very big thing. Frankly, I can tell you, as a matter of fact, when I've suggested all that I've been talking about the last, somewhere about 40-50% of them will tear my prescription and just go and say, look, that's it. You have no idea what you're talking about. And they say, look, we're not interested. We'll go and see. And they will go and see some other doctor. Some maybe rightly, maybe wrongly. I'm not going to justify myself, but I'm telling you how I felt about it. Even at the expense of, it actually takes a brave man to actually tell a patient, look, I want you to get more help in a different sphere of medicine. Not saying you go and see another orthopedic surgeon, another surgeon, saying a different sphere, which is where I bring in the psychologist and the psychiatrist. But I can tell you, major changes in the last, say, 5-7 years, people are much more open to it, and people realize that, nothing is coming out of it. Maybe I need to look outside the sphere of the hardcore medicine of, operations and surgeries and all. So much more a changing attitude. But the younger people seem to be more taken up now, and they sometimes can actually influence their older people who come to them and say, look, why don't we have a go and say, what what harm can come out of it. So huge. I totally agree with you. Big issues, big issues. But you need to take them gently through it. So just, don't wipe your hands and say, that's it, I'm not helping you, get out of it. You need to say, look, I'm going to work with somebody else to bring you into it. And it's not a disease. It's more like a, situational things. Majority of people are having situational issues, problems at work, problems at home, problem with husband, wife, problem with children. So it's a very situational thing. And the more you sort of bring that into it is very, very important. So another subset, Sonakshi, which I forgot to tell you, is, that the very young is, that 14 to 18 kind of a stuff, in the throes of trying to get an education and all, and getting stuck with the pressure for not performing and everything, and then getting stuck with, poor results and all, manifesting as, oh, I'm getting headaches, I'm getting body aches, my back is giving me so much of pain, I can't study. That's another group. Sorry, I know it's another topic maybe for another day. But that's another major group which I seem to come across. And, sometimes the patients, the parents just will not accept the idea that there is anything that the child is not. They all think, look, my child cannot have anything but a real problem. And I think you dealt a lot with these kind of parents and say, look, maybe we need to explore, maybe we need to let the child be a little bit free in a different environment, maybe give them a gap year. Sometimes it works out, but you know better than I do about that.
I thank you, Dr. Bedi, for such an enlightening discussion, because I really feel that this is very much needed. Everybody needs to work together, medicine, allied medicine, paramedics, to be able to help the patient more holistically. So thank you very much.
Absolutely. And thank you so much for raising the issue. Thank you.